And as the province continues to battle the number of COVID-19 cases in long-term care homes, a big announcement today from the Premier. Cynthia Mulligan has that story for us. Cynthia, what can you tell us?
Well, Janelle, it was an unprecedented update from the Premier today, who clearly seemed frustrated with his Chief Medical Officer of Health. I'll get to that in a moment, but first to long-term care homes. Doug Ford says they are in the midst of a raging battle against COVID-19, and now the province is calling in the Army for help, just like they have in Quebec.
We will begin by directing that the additional personnel be deployed to 5 priority homes in the province. Their support will provide staffing relief so staff can focus on the care of the residents.
There is a devastating crisis playing out in long-term care homes. Out of the province's total 659 deaths, 447 residents in long-term care homes have passed away. Close to 2,000 residents and almost 1,000 staff have been infected. And while the spread gained speed, the province appeared painfully slow to respond. Delays getting workers personal protective gear. And only today, despite lessons learned from SARS, are staff barred from taking shifts in multiple homes, which health officials agree has greatly contributed to the spread. In addition, despite calls for weeks from the opposition, only now will all long-term care residents be tested, something the Premier expressed frustration with today.
There's many people, I was one of them, sitting there beating the drums 2 weeks ago saying we need everyone tested. Again, I can't, as much as people may think, I can jump in there and overturn what the Chief Medical Officer says. I can't.
It seems to me from what you're saying that you aren't happy with a lot of the decisions that have been made when it comes to long-term care and the lack of testing that was called for weeks ago and only seems to be starting up now. Are your hands tied here? I don't understand. You're the Premier. I thought you were the one who called all the shots.
Well, the public health officer, you know, that's a separate area. Again, that's totally separate from the jurisdiction under the Premier. He has powers that I don't have. As I've said, you see the cracks in the ship, and you have to fix them. But I'll always rely on the advice of our medical professionals, health and science.
Now, Liberal leader Stephen Del Duca disputed the Premier's response, saying he's hiding behind doctors and does have the power to take action. So there clearly seems to be cracks between the Premier and his Chief Medical Officer of Health. I asked Dr. David Williams about that today.
It seems to me the Premier threw you under the bus today. What is your response to that?
I think the frustration, if the Premier has, is the same as I've had. At different times, we would like to really ramp up a lot more testing, a lot more things quicker. We were limited first by reagents and by swabs. Again, I give them the best advice I can, but we need the power and authority of the minister, as well as the ministry and the Premier, to back up those with resources and materials so we can get on and get the task done.
Now, I'm still waiting to find out which 5 long-term care homes in the province the Army will be going to. Toronto Mayor John Tory says it will not be necessary to send them to any of the city's run long-term care homes. There are 10 in Toronto.